What we know that PAD patients after lower extremity revascularization have a high risk for developing acute limb ischemia. The risk is fourfold increase, but that's not the end of the story. We know that after ALI, there's subsequent further complications. So VOYAGER-PAD was a randomized controlled, placebo-controlled trial looking at more than 6,500 PAD patients immediately after lower extremity revascularization within 10 days. Patients were either randomized to rivaroxaban 2.5 milligram or to placebo, and that was on top of aspirin. And about half of the patients received clopidogrel at the discretion of the investigator. So what we saw in the primary results of that study, that the time to first event, there was a very high event rate of 19.9% events in the placebo group within 3 years. And that was reduced significantly with rivaroxaban with an absolute risk reduction of 2.6. But that was, remember, time to first event. Now the present analysis was now performed to look not only at the first event, but at the totality of events, so subsequent also. Now, if we looked at the totality of events, we could see that 1/3 of the patients had at least one further subsequent event. So we observed in the placebo group an event rate of vascular events of 88, over 88 per 100 patients events, and that included major adverse limb events, MACE, recurrent revascularization, and venous thromboembolic events. So it's a very high rate, over 88 per 100 patients, and that was reduced significantly with rivaroxaban with an absolute risk reduction of 12.5. That would translate in a number needed to treat of 8. If we looked at the primary events, there was also an addition of more than 50% of additional subsequent primary events, and that was reduced with an absolute risk reduction of rivaroxaban by 4.4%. Well, there are several lessons from VOYAGER-PAD to be learned. First is those patients with peripheral arterial disease, if they have to undergo lower extremity revascularization, they have a high risk for first events, but they have a very high risk for subsequent complications. So if we had looked only at the first event, we would have really missed more than 80% of the overall benefit of rivaroxaban. So that's one important thing. We have to look at the totality of events. The second important thing that we noticed is that those patients that have limb symptoms and limb complications, they have a very high risk for suffering further limb events. That's quite interesting because the patients that had a subsequent lower extremity revascularization during the study had a high risk of limb events, but the risk for MACE was not that large. If we look at the other side of the medal, if we look at the patients that came into the study with coronary artery disease, and about 1/3 of those patients had coronary artery disease, they had an even higher event rate, but they had more coronary events compared to those patients that entered the study without coronary artery disease, that came into the study because primarily limb events, they had a high risk of limb events. So what we conclude from VOYAGER is that those patients with peripheral artery disease are prone to suffer from further limb events, while those patients that have coronary artery disease have a higher risk for coronary events. Also, I think in the future, we have to look at dedicated PAD trials with specific PAD populations, looking at combined endpoints, limb and major adverse cardiac events. And we have to look at the totality of events and not just look at the first event. Otherwise, we miss the whole burden of disease and we may miss the benefit of the treatment.